Hi, this is Alan Wood from Ultimate Sports Medicine. One of the things that patients commonly come into our office with is pain on the bottom of their foot. And often they've self-diagnosed it through WebMD or some other source as plantar fasciitis. And sometimes it is plantar fasciitis and something that we can very easily treat, but sometimes it's not. So if you're having some pain on the bottom of your foot that's not getting better, I wanted to go over some of the anatomy of some of the other possibilities of things it could be and that we can treat you for. So I'm going to highlight this. Okay, so that highlight in seafoam green, that is the plantar fascia. The skin is taken off this. This is the Visible Body Anatomy app. So when you have pain in the middle of the foot, that's probably not plantar fasciitis. It could be, but this area resolves really easily. The more difficult pain, plantar fasciitis, is the stuff down here by the heel. So sometimes it is that, and the heel is the calcaneus. That's that bone there. Okay, going back to the plantar fascia. We're going to hide the plantar fascia and look what else is in there and see what else is underneath there. So if we look here, there's other muscles that can hurt on the heel. This one's a common one. This is called the flexor digitorum brevis. It's right underneath the plantar fascia. And then over here, also right underneath the plantar fascia. I'm going to try to move it a little bit so we can see over that way a little better. That's called the abductor hallucis, and it goes out here to the big toe, but look where it attaches right here where that plantar fascia was before I erased it. So I'm going to take that off, and let's take the flexor digitorum brevis off as well. And look at that. There's another muscle. That's called the quadratus plantae. That can also be painful. And then over here, attaching in the same place, there's this structure. It's like a ligament called the flexor retinaculum that holds all these tendons down, go to the toes. We're going to take that off. And let's go ahead and take the quadratus plantae off. And look, there's even more stuff down here. Okay, there's these things that's called the long plantar ligaments. So all of these are structures that you've got to consider when you have pain on the bottom of the foot. So we don't just assume that you have plantar fasciitis when you come in the office. We assess and differentially palpate the structures so that we can give you the right treatment for this. So if you're having some plantar fasciitis that won't get better, give one of our doctors a call. Additionally, there can be nerve entrapments down here. So I'm going to add some nerves on here. And look at that. You see this yellow stuff. And now we'll turn this one off and we'll highlight that. So both of these nerves also go right down here by the plantar fascia. But that's not a nerve. There we go. Sorry. I'll get it right. And that's the tibial nerve that's splitting into two plantar branches down there. That can also get entrapped in some of those tissues that I took off of the picture. So again, have one of our doctors check you out, make sure that what you have really is plantar fasciitis so we can get you the right treatment. Nice to talk to you. Take care. Bye-bye.